session today is organized by our nutrition working group, and it's on the topic of scaling nutrition interventions, the role of the private sector. I want to give you just a few words to start with on the scaling community practice, since not all of you may have previously joined events of ours. So the scaling community is about 9 years old now. We're in our 10th year. We have around 4,000 members from about 70 countries and over 400 organizations. In addition to our annual forum, the community issues roughly quarterly newsletters. We have issued 28 so far. We operate 10 working groups, which explore particular scaling issues through the lens of various sectors and thematic issues. And each of these working groups hold intermittent virtual meetings, and each has a landing page on our website, the community's website, which is www.scalingcommunityofpractice.com. And Gabi, could you maybe put that URL into the chat? Thank you. Now, we're a bit of an ambitious group because in recent years, in addition to serving as a platform for exchanging experience and knowledge and share insights about scaling, we also have gone beyond peer learning, and we now aim to actually move the needle with regard to the practice on scaling across sectors, across geographies, organizations, and perspectives. And so we invite you all participants today, to either continue as active members or to join us and our working groups. We're volunteer run, we're free of charge. It's a really labor of love, and we're as strong as all of you, our members are, and each new voice adds to our efforts and makes us stronger. As I said, if you want to learn more, go to our website or reach out to us on scalingcop@msi-inc.com. Again, Gabi, if you could put that contact information in the chat, that would be great. So with that by way of background, let me introduce today's session. But before I do so, 2 housekeeping matters. First of all, we're recording the session, and we make the recording available via our website ultimately, and also plan to summarize the proceedings of all our events, all our sessions in this forum in our next newsletter. Second, we have interpretation into Spanish and French. If you want to have listen to our English-speaking panelists and presenters in Spanish or French, go to the top of your screen. There are 3 dots along the bar that say more. Under the 3 dots, it says more. If you click on the 3 dots, it'll take you to a menu, and that menu has language on there. Click on language, and that will take you to translation, and you can select then the language of your preference. I hope that works for you. Now, with this, let me introduce our moderator today, Charlotte Lane. Charlotte actually has joined me as co-chair of the Nutrition Working Group, and indeed will be moderating the discussion today. Thank you, Charlotte, for taking on the task of reviving the Nutrition Working Group, which had been dormant, unfortunately, for 2 years. And I really can't think of a better chair than you and moderator for today. Charlotte, for everybody who wants to know her background, Charlotte has a PhD in nutritional epidemiology. I hope I pronounced that the right way, Charlotte. She recently founded and leads a small consulting company, Food Security Evidence Brokerage, which provides research and advice on issues of nutrition and food security. Before this, she served 4 years as Senior Evaluation Specialist and leader of the nutrition portfolio at the International Initiative for Impact Evaluation, also known as 3IE. So with this, Charlotte, I'll hand over to you, and please go ahead with our really exciting session today. Thank you.
Yeah, Johannes, thank you so much for that introduction, and I'm very excited about this discussion today. So before I hand it over to the panelists, I'm going to take the liberty of framing this a little bit and explaining why I think this is such an important topic. So within the nutrition space, I think there's a interesting push and pull between this approach where we want to do these small scale, hyper-local, and highly intensive contextualized interventions, and wanting to do something that's realistic to implement at scale and to affect a huge number of people. Because of the size of the nutrition problem today, we really do need to be implementing interventions that affect hundreds of thousands, if not millions of people at the same time, as opposed to keeping this one village at a time approach that we've taken in the past. So I don't want to harp on the issue of stats too much. I think we all know that we're in the middle of a food crisis that's driven by interrelated issues of conflict, climate change, and economic instability. That economic instability itself is the result of a COVID hangover, as well as conflict and climate change. So we need to start being more proactive about this issue and getting ahead of it to keep people from dropping further into food crisis, as opposed to just remediating the situation, essentially. I think we're all used to this "we can't wait" type of message coming out of the climate change community, but there's that same urgency in the nutrition space as well. We know that a lack of action now makes it infinitely harder to help people in the future. It's so much more expensive to remediate malnutrition than it is to keep malnutrition from developing in the first place. So just as an example, if we think about the first 1,000 days, there's simple low-cost interventions that we can do to prevent stunting and wasting, such as the promotion of healthy feeding practices. And then this can prevent the development of a lot of chronic health problems later in life that are associated with chronic childhood malnutrition. So in order to prevent people from falling further into food crisis, we're going to need a stable food supply and a stable way of producing food. So that's why I'm really excited to hear about the World Bank's new Global Challenge program, which is going to be a new tool to achieve sustainable impact at the national and the global scale. I'm not talking about that too much because that's what one of our speakers is here to talk to us about. But the program is meant to get ahead of this global food crisis, to improve nutrition, and to change the way that we produce food. This is just really exciting because of the size of the goals that they've set for themselves. But a part of addressing this food crisis is going to be engaging with the private sector. That's how we're going to change the way that we produce food. And we already know that the private sector has this incredible influence on global nutrition. They sell the food that we eat, they arrange the stores that we shop in, and they even affect the agricultural practices that are used to grow our food, or in the case of subsistence farmers, to grow the food that they directly consume. So if we know that the private sector has a huge effect on nutrition, we kind of have this idea of, well, let's harness that effect for our own purposes. And I think another reason that we keep looking at the private sector is there's this inherent assumption that activities implemented through the private sector are going to be more sustainable. If we can make these activities profitable, we can eliminate the need for continuous inputs into the system. And we also think that the private sector is magically more efficient than the public or NGO sector, so we hope that they can do the same with less. And I think that that's this great aspirational theory where we're going to harness the influence of the private sector, use them to drive food systems transformation in a sustainable way, and that's going to lead to this awesome, healthier, and more nutritious world, which is a great idea, but there are some stumbling blocks in that. And I think two issues that are interrelated and come out of this are mistrust and conflicting priorities. So starting first with the issue of mistrust, I think we as the nutrition community tend to look back at issues in the past, like Nestle promoting formula in LMICs, and that makes us nervous. And then we look around at the state of things now and we see what's going on with like the soda and snack food industry, and we get even more skeptical of the motivations of the private sector. So we're not convinced that they're going to act with the best interests of our target populations in mind, and that makes us hesitant to engage. But on the flip side, when we think about the private sector, they tend to view us as asking them for charity. they don't necessarily see that there's a realistic path for profitability. And while I think we should assume that generally private sector actors are well-meaning, they're not acting altruistically. That's not their primary goal. They are and should be acting in a somewhat self-interested way, and we should actually be supporting that, which I think is kind of a key point that sometimes we overlook in the international development space when we work with private sector actors. We want them to be functioning in a way that's in their best interest. That's how they stay sustainable, and that's how we leverage this theory of change that we think is going to work to achieve long-term, scalable, and sustainable change. So if something goes against their best interest, it's going to make them less profitable. They're going to start needing continuous inputs, and essentially they're going to end up acting like an NGO. So they need to be profitable, and our goal should be to work with them to innovate and develop profitable products and approaches that will improve nutrition outcomes. The private sector does not really want to function in a way that leads to poor nutrition outcomes, but they know that these approaches are more profitable. Coke is a lot easier to sell than carrots. That's just the way the world works. So then this question becomes, how do we scale nutrition interventions generally? And is there a way to do this through the private sector? So we have some great examples of this today, both large-scale generalized nutrition programs and specific private sector engagement programs that we're going to talk about as soon as I introduce our panelists. So thank you for letting me get on my soapbox a little bit about this. But we have great panelists, Jenny Walton, Sneha Kanaganti, and Mira Shekar. So starting with you, Jenny. Jenny is the head of commercialization at Harvest Plus. She has over 25 years of experience working on food systems transformation, and she's currently leading the strategy to embed biofortified seeds, foods, and grains into food systems through commercialization and innovative technologies. Then we have Sneha Kanaganti. She's the private sector lead at the Global Financing Facility Secretariat, where she manages the GFF's innovative financing, private sector partnerships, and country support to governments on private sector solutions for health and nutrition. Sneha has 15 years of experience working in global health at the World Bank and IFC. And finally, we have Mira Shekar. You are on the call already. Sorry, I wasn't sure you were going to make it by now. Great to see you. So Mira is our global leader for nutrition at the World Bank's Health, Nutrition, and Global Population Practice. Sorry, I stumbled there. It's a mouthful, but Mira manages key partnerships and positions the World Bank's initiative on human capital and the agriculture, food security, and protection agendas. Mira has a variety of accomplishments to her name, including efforts to reposition the nutrition agenda, which led to the Scaling Up Nutrition, or SUN movement. And she also was a founding member of the Catalytic Financing Facility for Nutrition, which led to the Power of Nutrition. So Mira's already been involved in a lot of big programs. I'm going to hand it over to the speakers now. Everyone has 5 minutes for their opening remarks. Then I have a series of questions, and we're going to try to have 30 minutes for Q&A. While the speakers are talking, I'm going to encourage the audience to put their questions in the chat. Speakers, if there's short answers that are easy to just reply in the chat, go ahead and do that. If there's longer ones that you want to make sure you have a chance to respond to, you can either flag these to me in the chat or just jot them down on the side, and I'll give you an opportunity to reply to those after I ask my questions. So with that, I'm going to hand it over to Jenny to talk to us about Harvest Plus.
Hello, thank you. Hi, everyone, and thanks for joining, and thanks for inviting me to be part of this. I work for CGIR. I'm based at the International Food Policy Research Institute and specifically work on the Harvest Plus project. So to the background to why Harvest Plus, half the children in the world have at least one micronutrient deficiency. 2 in 3 women worldwide are affected by hidden hunger. And it's true to note that the lower your income, the more likely you are and the more severe the malnutrition is likely to be. But micronutrient deficiency or hidden hunger is rife all over the world. When you view those stats in the light that we're all united as human beings by reliance on staple foods, wheat, rice, maize, beans, millets, pizza, pasta, chips, crisps, bread, globally 60% of the calories that we consume are from the three major staples, so wheat, rice and maize. So you can see a route to fixing or going towards fixing hidden hunger through those staple foods and seeing them as a vehicle to reach more people at scale. And it took an economist to see that connection. So Howdy Buis, the economist, the founder of the Harvest Plus project, started that mission 30 years ago. Dietary diversity is the key to ending hidden hunger. There's no doubt about that. But even in populations where people can access everything, whatever you want, deficiencies still pervade and hidden hunger coexists with obesity. The Harvest Plus project is based on the idea that you can improve the food system from the ground up. You can develop better, more nutritious varieties of the major staples that we're all eating. And in big picture terms, because of the work of the CGIAR, there are now biofortified varieties, so more nutritious varieties for all of the major staples at some place in the world. But that's just the start of how you start to fix this problem. You have to get the seed to the seed multipliers. You have to get the seeds to the farmers. You have to get the grain to the millers. And you have to get the flour to the food producers, to the retailers, and to the consumers. Without the private sector, without the seed breeders, the farmers and the retailers, this is not going to succeed. And we need the seed, grain and food businesses to embrace and adopt biofortified varieties. So to date, 100 million farming families are involved in biofortification. An additional 400 million more consumers are buying biofortified foods in the market. That couldn't have been achieved without private sector partnership. And we've made impacts starting with smallholders, but if biofortification is to be anchored into the food system, we have to hand it over to the private sector and work from the top down. And we need collective action from big seed, grain and food businesses, as well as the small, medium enterprises. If we don't do this and we don't continue to propagate this private sector partnership, the last 20 years of scale of biofortification has the potential to go backwards. And luckily, high performing varieties of biofortified seeds are really easy to sell into the private sector. Biofortification sits at the nexus of all of the major consumer trends, so natural, clean label, plant-based, immunity, ethical, all of those things that consumers are really interested in. So the demand's there, and the skill it really is to connect that demand with consistent high quality produce. And that's the skill that we've developed for the delivery model. The diagram behind me is about how you link every single private sector partner through that value chain together and connect the supply and demand at each stage. It's not just a consumption at one end and production at the other. These little sequences of events throughout the chain that you have to connect together. And that's where that private sector partnership really comes into play, and how the future of the Harvest Plus project is going to survive.
Awesome. I think this is really interesting to hear about just like the whole process that you're using to make this a good proposition to the private sector as well. So Sneha, we're going to hand it over to you to talk a little bit about GFF and some of the specific examples that you have engaging with the private sector.
So I should say that since I'm the private sector specialist at the GFF, my colleagues who work exclusively on nutrition interventions can really get into the deep dives of how we do this at the program level. But to give you the bird's eye view, as of now, we have approximately 30 out of the 36 currently supported GFF countries that include nutrition interventions in their investment cases and or their World Bank and GFF co-finance projects. And the way that the GFF has been supporting nutrition is looking at where we can help integrate this into the continuum of reproductive, maternal, and child health services. And this is in a few different ways. One is building the capacity for countries to deliver nutrition services at the community level and at the health facility level, training health workers to improve child feeding practices, strengthening supply chains to help integrate and deliver nutrition commodities, And lastly, on the resource tracking and data production aspect, to make sure that when countries are developing their nutrition plans and strategies, they're actually doing it with the best available data. So that then gets us to, well, how do we work with the private sector? So we have three pathways for private sector engagement overall at the GFF, both across health and nutrition. The first is on innovative financing. The second is on partnerships with private sector, usually at global or regional level, but linked to country needs and priorities. And then lastly, I think our biggest pathway is the support to countries to leverage private sector capacity to deliver services and products. So on innovative financing, and here we really look at mobilizing resources to fund the delivery of nutrition services, also bringing in a results-based element for said financing. And two examples that we've done have been the Development Impact Bond in Cameroon for kangaroo mother care for low birth weight babies. And this was implemented through both the public and private facilities. So it involved bringing in upfront financing from investors that's then at risk based on how the program delivers. In this case, the program itself was actually a very big success in terms of outperforming the expected targets. However, I think there were some learnings for us in terms of additionality and how do you balance what types of private sector financing you're bringing in, and you're looking at, is this the optimal use and structure of these instruments? We also had a results-based loan buy-down in Guatemala, where the GFF put in a 9 million conditional grant to buy down the interest on the World Bank and GFF loan of a co-financed project. And the condition was that the government, for every dollar that GFF would put into buying down the loan, the government had to show that they put in twice as much into their nutrition program. So it was a very clear way of increasing domestic resources and bringing in that level of accountability. And the program itself had some very specific targeting that the GFF also emphasized in terms of what types of communities and geographies the women who would benefit from the program would be from. And then on private sector partnerships, this one is not exclusive to nutrition, but we had a partnership with Milk for Mothers, UPS Foundation, and Gates Foundation on a supply chain partnership, specifically to look at where private sector can support on distribution and warehousing. And so kind of that last mile of delivery. And there was a lot of work done in Mozambique to help the central medical store there look at where they could outsource certain last mile functions to the private sector for their health and nutrition commodities. And then lastly, as I mentioned, our largest bucket of support has been in supporting governments, both with financing and with technical assistance, to contract with private sector, both for-profit and not-for-profit, to deliver nutrition services. So some examples have been in Nigeria, DRC, and Cameroon. We've also supported more recently public-private dialogue and applying the private sector market framework in Indonesia for rice fortification, where the process really started from what do we want to achieve, what's the bottlenecks, and where's private sector part of the solution. I think as we heard from colleagues on the panel, especially in the manufacturing in rice fortification, it really is, I think, a win-win when you think about private sector coming in. I also want to mention the support that GFF provides on innovation. And for us, innovation is both service delivery model innovation as well as technology innovation. But a couple of examples of where we've worked with private sector providers has been on in Rwanda and Indonesia in developing digital tools for health workers to improve their nutrition service delivery, as well as tools like the Child Scorecard in Rwanda, where the government is then able to track performance and optimize much better. And some of these projects, in fact, have been co-financed, I think, together with Mira's group, particularly in Rwanda. So it's really a nice synergy of bringing different forms of funding together. So this gives you, I think, a little bit of a flavor of the types of engagement we've kind of had underway. I think some have worked better than others, and there are some that I haven't reflected here yet where we could do better, because I think we have an opportunity to get into those more in the following questions. So that's it for me at this stage. Thank you.
Great, Sneha. I am looking forward to those follow-up questions, and I think you did a fantastic job of setting up Mira to help us think through, some of the new programs that the World Bank has. So Mira, over to you.
Great, thank you very much, Charlotte. And apologies that I joined late. I'm in Rome, jet lagged and in meetings since the morning. Just arrived this morning and we've been in meetings since then. So big apologies again. I'm going to start with a sort of 10,000 foot view of what we at the bank are doing on food and nutrition security. First and foremost, we don't talk about food security anymore. We don't talk about nutrition security alone. We talk about food and nutrition security because both of those go together. Second, what I'm going to talk about is something that's emerged out of the bank's evolution roadmap. And one of the things that our new president, Banga, announced at the last annual meetings was that there were 6 global challenges that the bank is going to be much more aggressive in terms of responding to. And I won't go through all of the challenges, but just focus on the one that is most relevant to this group, which is the Food and Nutrition Security Global Challenge Program. So if you hear us talking about FNS GCP, that's what it is. We come up with a new acronym every few months or weeks. So the GCP, the FNS GCP has been organized around couple of things that are absolutely important for all GCPs and particularly for the FNS GCP. One is scale, and I know that's an issue that is of interest to this group. It has to be things that can be done at scale relatively quickly and get results again relatively quickly. And the other thing is it has to be a new way of working given the evolution roadmap so that we truly bring all the sectors and the institutions together. So it's not just the World Bank's GCP on FNS, it is the World Bank, IFC, and MIGA, all of us truly working together. And we're all here together in Rome discussing it with the partners. So the FNS GCP has 3 action areas. And feel free to stop me at any point because I can go on about this. We've been discussing this since October last year. And so I can go on forever, but feel free to stop me whenever it's time. So 3 action areas. One is around crisis prevention. And here it's our social protection teams that take the lead, but work in partnership with the HNP, Health, Nutrition, Population team, but also in partnership with the agriculture team and IFC and MIGA as well. A second area around scaling up innovative nutrition solutions. And here again, all of the partners are present, and I'll delve into that in a little bit more detail in a minute. And a third area is around climate smart agriculture. And all of these 3 action areas complement each other. One of the other big questions that's come to us is, how are you going to finance this? What is the new concessionality? Where are the new finances going to come from? So it's very clear. Well, first and foremost, we're anticipating that IDA will grow. And as IDA grows, this part for this will grow as well. So some part of the financing will come from IDA and IBRD as well. But in addition to that, we're looking at other innovative financing sources in addition to trust funds and the like. We're talking about something new called repurposing of agricultural subsidies. Globally, anywhere from 600 to 800 billion dollars are invested in agricultural subsidies, and many of these every year, and many of these subsidies are actually regressive. They either do harm to health and nutrition, or they do harm to climate or other things. So our teams are looking very carefully to see how we can repurpose some of these subsidies. And I'm going to give you a few examples from that too. Now, let me take a couple of minutes on the action area 2, which is the innovative nutrition solutions. And again, like I said, feel free to stop me whenever I've spoken too much. So on the innovative nutrition side, we're looking at both the undernutrition agenda as well as the overweight obesity agenda. You all know there are 148 million stunted children in the world, as several 100 million anemic women, but we also know that there are more than 2 billion overweight obese individuals at the same time, and many a times in the same countries, often in the same households as well.
Mm-hmm.
So we're trying to come up with some solutions that address both of these two ends of the spectrum. On the undernutrition side, you might have heard there's a lot of research that's been done on multiple micronutrient supplements, MMS, which address gender issues, but they also really address several of the other undernutrition issues. So we're planning to scale these up, MMS, through bank projects, IDA and IBRD as well. And then there is the new evidence on small quantity lipid-based supplements, SQLNS. Those, again, huge potential impacts on preventing wasting. For the first time, we have a tool to prevent child wasting, and of course, reducing stunting and anemia as well. So the plan is to add these two to an existing package of nutrition interventions. These are new, these are innovative, they have potential for huge impact, and deliver them. The innovative part is not just that these interventions are new, but we want to deliver them not just through health and nutrition projects, but also through social protection projects, so adaptive safety nets. This is, again, one World Bank group working together to do that. And linked to that, because we know sometimes there are challenges in terms of the commodities themselves. We don't have enough supply of these new commodities. So we're talking to IFC and MEGA to help support scale up the production of these as well through the private sector. And then on the overweight obesity side, and I'll stop after this so you can have the floor back. On the overweight obesity side, it's really about trying to transform food systems. That really is the overall goal. At one level, for the first time, we have a partnership between IFC, the bank, and the Gates Foundation to do much more on food fortification. First time we've gotten IFC engaged and involved in this. So that's going to happen. That'll hopefully move the private sector much faster than it has done in the past. And then on the food systems side, trying to make diets healthier. We have a whole slew of fiscal and regulatory policies, everything from taxation on unhealthy foods to marketing regulations, front of package labeling, mass media campaigns to educate consumers on these issues as well. That is a whole package, and we're working on that very aggressively with our trade our trade group within the bank as well. And just to give you an example, going back to the repurposing thing that we think is so important. At the moment, if you look at the 16 agricultural commodities that are part of the agricultural subsidies, among them, one of the biggest commodities that is subsidized is sugar. So yes, exactly. So think about it. On the one hand, we're subsidizing sugar. On the other hand, we're saying we should be consuming less of it if we want to improve food system, if we want to reduce non-communicable diseases. So trying to bring some of this policy coherence across many, many, many partners. That is one of our big global challenges. And that's one of the global challenge programs that we're all working on. So let me stop there. Like I said, I can go on forever. I've spoken too long already.
I think this is fascinating, and part of the reason we gave you the floor a little bit longer is because we know you're time constrained. I also had not maybe fully appreciated that we are subsidizing sugar at the same time we are starting to tax sugar. So that is ironic, I suppose. But I think, Jenny, we have to hand it back over to you. Some of what's come out is this question of coherence, developing common goals, and sort of getting everyone on the same team to move in the same direction. So we had a question for you about how we develop common goals between the private sector and the public sector, the nutrition community. So it'd be great to hear your thoughts on that.
I spent the first 20 years of my career in the food industry, and when I came to IFPRI, I realized that everyone was talking a very different language, and I found it difficult to understand, and people found me very difficult to understand. So understanding that that difference in language and how to explain things and words that you use is very important to really know your audience when you're reaching out and trying to understand those common goals. And quite often, we can have the same common goals. So as Harvest Plus, in terms of improving the nutrient density of staple foods, could be the same common goal as one of the major manufacturers, but they just have a different language, different way of saying it. So it's just sort of translating it and saying it in a different way, really, and repackaging what we do at Harvest Plus to fit what a food manufacturer might be looking for. We refer to the private sector like it's one giant body but it's not, and you have to really break it down into segments, into small, medium, and large, local, regional, global, seed, grain, and food, and think about what those individual companies might need. So the goal of a small food processor, so someone who's making like iron beans in Zimbabwe, is quite different to what Nestle, Unilever, Cargill might need. So understanding what a business objective is and how you can help a business actually achieve their goals. And it's not just the type of businesses we're talking to. When you talk to people in business, they have very specific roles. So somebody in R&D is very different to somebody who's in finance or supply chain. So understanding what that individual's goal is that year to achieve. For example, I talk to supply chain specialists all the time in big food companies, and they say, we love biofortification, we'd have it tomorrow, but how do I switch? How do I switch over the supply chain? And they say, well, it just needs a small investment for a season. We'll work with you to convert the seeds over, the farming over, work with you on traceability. And I don't have any money in my supply chain budget to do that. And why would I pay for that? Because this is a cheap staple. So understanding that person in supply chain's constraints on why they're not switching to biofortification and how we can help them is really important.
I like that specific example of a instance where you need one input to the private sector to help them overcome like a roadblock, and then you can sort of let the ball start rolling, right? And you don't need to keep putting these additional inputs into the system. So Sneha, we had it going back to you to talk a little bit more about how we can both identify partners to work with and then think through how we actually work with them going forwards.
Thanks, Charlotte. And this, I think, is a very tricky question, which I'm going to share my thoughts, but I'm also looking to learn a lot from everybody, both panelists and people who've joined us today, on the collective wisdom around this. Because the way we've seen this work in terms of who to identify as the right partner really comes down to, I mean, a lot of what Jenny was saying about what are you actually trying to achieve? Because the type of private sector partner, and whether it's a for-profit or not-for-profit, are they on the service delivery side? Are they making products, distributing products? Is it, an IT partner? Is it one of the big agriculture companies? And we've had engagement, or at least dialogue with, I think, all of these sections or types of partners. And some have been easier to work with versus others, not because they're particularly difficult as people, but because of institutional and organizational alignment. So I'd say that's the other one. So as you're identifying what is the need and what's your target outcome, also thinking about what's kind of the core mandate of your group, like for us with GFF, with women and child health and nutrition, it's a fairly narrow focus in terms of the whole spectrum of nutrition and health services and products. So that's been one thing. Like, for example, if companies that are working with NCD drugs come to us, that's unfortunately not something that we can actually work with. So the whole alignment aspect. The other thing that comes up when we have this dialogue with governments, because I think when we're thinking about what type of private sector to bring in, making sure there's actually buy-in and ownership from the government for the same thing, as well as the capacity on their side to manage it, is critical. And yet, when we have the dialogue with government, in many cases, there's still, I think, a default public sector mindset. And so then the question becomes, can we get the right data to consider where are patients actually getting services? Where are they going on their own? And how do we reach them where they are versus constantly trying to redirect them, because we may only have mixed success with that. So that whole patient-centered and data-centric approach also helps identify which partners. For example, if there's a public health facility that is fairly distant from your target group and there's private facilities closer by, I think losing the opportunity to bring those private partners into your sort of network, making sure they have the training and the products and that they can offer those services without increasing out-of-pocket cost. It's easier to have that dialogue if you actually know where the different facilities are and where the groups that you're trying to reach are. And then lastly, I'd say, maybe two things. When we've discussed with private partners and when we've brought some of them in, there's been this question of how do we do it in as transparent a way as possible? Because there is, I think, a lot of benefit for the private sector, especially global private sector, in working with organizations like the GFF, like the bank. And if you don't do it right, you could also create a sort of inequality in the dynamic amongst competitors, which you don't necessarily want to do. And then making sure that you're also thinking about potential market distortions with us coming in. And I think similar to what Mira raised about how if one side of the development community is doing one thing, but then the other one is doing something diametrically opposite, you're not going to see the impact on the ground. And we may not be able to all fix all of that, just given how diverse the global ecosystem is in development. But the reason I mention this is because recognizing that potential upfront may also help you figure out if that partner is right for you or not, because you can actually work with them to create a result. And we've seen this particularly when looking at partnering with private sector for investments on the ground, like around manufacturing and distribution. I think that's where it's come up the most, this aspect of potential market distortion. And then the last one is on additionality. And I can explain more, I think, in our follow-up question as well. But additionality to us at GFF means, does working with private sector help us do something better or more of something that's already good than we could otherwise do? Because if not, then it may not be worth the added transaction cost, et cetera, that often comes with engaging with private sector. So that's some of the sort of screening criteria and things we ask ourselves when we're looking at who do we partner with and how.
That's fascinating to hear sort of the decision points that are coming up throughout this approach. So Mira, we're going to go back over to you. I know that you have to hop off at the top of the hour, so I'm going to give you both sets of questions at the same time, and you can choose to answer whichever ones, however you prefer. But the questions that we had for you for, first of all, to think about the Global Challenge Program's general approach to food security and nutrition as a tool to achieving sustainable impact at scale. And then the second round of questions that we'll go for right now is to talk a little bit more about the difference between this approach and traditional World Bank approaches to food security and nutrition, as well as how the World Bank expects to involve the private sector in the GCP. That's a lot. Do as well as you can, keeping that all straight in your head.
Great. Thank you very much, Charlotte. And thank you again for being flexible. On the first one, the general approach, I think I've laid it out already. So I won't spend too much time on that one. Essentially, what is different this time around? Let me speak to that a little bit more. Essentially, what is really different is we all talk about working across sectors. Nutrition, as we know, you cannot solve this problem by just working through one sector. You really, truly have to work across sectors. And even the panelists that are speaking today are talking from different perspectives and different sectors. And we all in every institution talk about working across sectors, but we find it very hard to do. It's extremely hard to do. So what's different about the GCP this time around is that we are planning from day one with all the sectors in the room. We've never planned projects with IFC in the room from day one in the past. And we've never planned projects outside the bank, with private sector in the room when you are designing something. And so then you get ownership from this much wider group of stakeholders. We're talking to social protection right at the beginning when they're designing their social protection cash transfer programs. It's not just conditionalities that they can add to that can improve nutrition outcomes, which has been shown to work, but they can also deliver MMS and SQLNS through social protection programs. What does that mean? We can go to scale much faster than we would if we just depended on the health projects or the nutrition projects. So that is really quite different. The other thing that's different is focusing quite heavily under the GCP on the climate side. How can we do things differently? Climate smart agriculture is really going to happen, and hopefully, as we address the climate smart agriculture piece, we're also addressing the related food systems issues around unhealthy diets that I mentioned earlier as well. How do we make that happen? Again, we need everybody in the room together and see what each partner, even within an institution like ours, what can each global practice deliver to make to address these really complex issues. So that's what's different, working across sectors, bringing in private sector engagement, not just for supply chains and stuff, which we are doing but also discussing with private sector what they can do in terms of improving the food system, getting better, healthier foods. And then within our own shops, trying to address the conflicts in terms of the kinds of policies that we all have in place. How can we address those so that we are actually all trying to move in the same direction? So that's what's different about the GCP, really. New innovations at scale, working across sectors, and a very, very strong focus on results and metrics as well. We didn't talk too much about innovative financing, but that's another area of strong interest and an area that we will be developing within the Global Challenge Program. With the Gates Foundation, we're talking about something like results buy-downs that was done many years ago for polio. Can we do that for nutrition as well? I think it's possible. we'll have to wait and see. So let me stop there. And thank you again very, very much. I really appreciate your flexibility as well.
Yeah, it's been great to have you and to hear the strong overlaps between the GCP, what you're doing, and the challenges that you've identified in this sector, and the actions that Sneha and Jenny's groups are also taking to address these same challenges from slightly different perspectives and at slightly different scales. But I feel like the global nutrition community is at least narrowing in on what the challenges are that we can start working on. So that's great. And along that line, Jenny, we had a question for you about how we can find common goals and shared value between the private and the public sector.
I think in many cases we already do have common goals, but it's, to my point before, it's about language and maybe rephrasing what we're trying to do to meet the goals of what food businesses are trying to do. I think we can have that kind of perspective that we sit here in our sector and sort of say what the private sector should be doing, but we kind of like view food businesses as the delivery organizations who are going to take nutrition interventions to scale, and they're almost our customers in some kind of respect, because we want them to change, and having that much more positive dialogue with seed grain and food businesses. That's my point before about knowing your audience and understanding what different businesses are trying to do. So really understanding different businesses, what their goals are in terms of not just sales and top line growth and bottom line growth, but what are they trying to do in ESG commitments, CSR commitments, what have they committed to their shareholders and stakeholders, and kind of looking at them and then working out how our objectives can actually help them achieve their goals. And they're not that far off. We can sort of sometimes think of the food industry or the private sector sat around with like giant pots of money and thinking about just selling food, but it's really not the case. When you do work in these businesses, they have a lot of different objectives, and healthy customers and are happy customers that are going to keep coming back. So looking to them of how we can work with them to achieve their goals, rather than sort of going down the sort of stick approach of saying you must do that and you must reformulate and the problem is because of you. We sort of view the food industry as part of the solution, or the only way for the solution, really, not just the cause of the problem. And when I was saying before about when we do talk to private sector, if you just got to go knocking on doors and saying, hey, I'm Jenny from Harvest Plus, having been on that side of things, when you're talking to sort of charitable organizations and NGOs, you sort of sat there thinking, well, what do you want? Why are you talking to me? And are you just asking me for money? And if I did give you money, what are you going to do with it? It's sort of being very clear up front when you have these conversations of what you can offer the seed grain and food businesses in terms of business value, and what you need to do to actually give that to them. Because if we come across as charities looking for money, and that's not gonna work at all. We have to sort of collaboration and making our common goals known.
Yeah, I think the nutrition community has a reputation for finger wagging a little bit, and we need to get over that and start. I like the idea of viewing them as clients, right? Like, we need to be offering a service that is going to be benefiting all parties involved. So Mira, acknowledging you have to go off in 3 minutes, do you want to say any final words before we hand it over to Sneha for her last question?
I guess the only other thing to say is to emphasize the fact that whatever we do, we need to move from boutique projects to acting at scale. And sometimes that requires different tools, different skill sets as well: program management, financing, procurement, all those sorts of tools. And we as the nutrition community probably need to invest a little bit more in those spaces, in addition to the technical work that the community does an amazing job on. But if we want to go to scale, we have to look at these other skill sets that are critical. And we can take a ride on other people's agendas, social protection being one of them. They'll welcome us with open hands. And there are many other such groups as well, the agriculture group more and more, as well as the health group as well. And now, from all that I'm hearing from the other panelists, the private sector groups are interested as well. So let me stop there. Thank you again very, very much.
Yeah, I like the idea. I've talked to people and said, I think it will be hard for you to come up with a topic that isn't related to nutrition. And I can connect it to almost anything. So we need to start going to those other sectors as well and saying, this is what I can offer you, Jenny, coming across with that client-oriented approach. I can offer you this, and education is another great example of that, where we can provide value to their projects as well. So Sneha, over to you. You were going to talk to us a little bit more about some more general approaches, I believe, to private sector engagement.
I think we were actually going to start getting a little bit into the value aspect as well,
Sorry,
Charlotte, which which I think other panelists have actually started the answer on, because when I think about what's been shared around having private sector in the room from the beginning, the co-create value versus public sector going off in a corner, coming up with something and then telling private sector, well, this is what we're going to do, not actually recognizing whether private sector can do that or not, because you haven't talked to them to understand what's possible. And that might also mean that you miss out on some innovative solutions that the whole system would benefit from. So definitely the co-create aspect, I'd say, is like critical to the making sure there's value for all, but also having the conversation. I see Mira has to head out. Also having the conversation up front on actually what value is each party expecting to get from this, because I've also seen the danger of assumptions on, I think, anyone's side, and how if we're not articulate upfront, both from a public sector side, a development partner side, and a private sector side, you may find yourself then having more challenges down the line. So upfront, figuring out what can this partnership do for everyone and what may be limited in not being able to do. And then I also want to echo, I think, Jenny's point on it is easy for us as development community to look to private sector as just kind of a giant pot of financing that we can tap into and it'll somehow answer all of our problems. And I've had the same experience where our private sector partners are like, we don't want this to be just about financing. Like, that's just one of the things that we provide, even when we're thinking about CSR or grants. There's so much more. And when it came to the supply chain partnership that we did in Mozambique, that was actually a way for the logistics teams on the corporate side of those companies to be able to give their time to Mozambique to say, well, can we bring our skills and expertise to you under the government's guidance to map out what are your problems, what could the potential solutions be? So the idea was to go beyond just financing, but also think about what's the expertise and sort of capacity that could be brought in as well, and like best practice from private sector that gets brought to the public sector. But then I also think there's an important question and maybe a little bit of a tension as well, where on the one hand, when you look at places like the GFF or like the World Bank, we do have access to different instruments, especially across the bank group, like blended finance, making sure we could use grant concessionality in a strategic way for private sector partnerships, private sector investments to become more viable while targeting the poor. Because we know that if you don't have that added, I guess, incentive or shaping mechanism coming in with this kind of blended finance, and or technical assistance, well, private sector will just respond to market forces, which usually, and their own competition pressures, which usually involve them aiming for those that can afford to pay and like at the upper end of that income pyramid. But the goal for us, I know, is on the other side. And so being able to say, if we can incorporate this in the design and the implementation of this joint investment together with you, and in exchange for being able to reach those communities that would otherwise be left out, we can provide some grant financing to kind of grease the wheels and make it all work. So that's on the one hand, on the sort of, here's the positive instruments that we have. But on the other, I want to pick up on the point that Johannes put, I think, in the chat of there's sometimes a view that private financing can close the funding gap. I think not just for nutrition, but also for health. Like we've heard this even more so a few years ago than now. And what we're seeing is that private sector financing is very unlikely to replace the need for public sector funding, because the types of things that private sector is investing in are very different from what we want governments to spend money on. And when I'm thinking about the actual delivery of interventions and of services and who pays for that, it usually is some form of public financing if you want it to be equitable, at least when we're thinking about the poor. Where I think there's more value in kind of bringing in private investment is one on the manufacturing space, on the distribution space, because that's where there's clear comparative advantage on the public sector side, both for health and nutrition. I'd say if you're thinking of the health sector, there's probably also certain pieces like labs and diagnostics, which are much more in the purview of the private sector versus the public. And there's probably similar pieces like that on the nutrition value chain if you look at it. So there, I would say it totally makes sense to support private sector to expand their infrastructure to contribute those things. But then in terms of actually paying for those commodities and then making sure that the end user, especially if they're poor, doesn't have to pay out of pocket for them, that's where it's very dangerous to look at private sector financing replacing or somehow, taking the role of what government should otherwise be trying to cover. The other role that I see private investment potentially being useful in is as a kind of a bridge. We know that governments have, finite budgets. We know that a lot of their growth in budgets for health and nutrition is tied to their economic growth. And this can sometimes take, there's a certain timeline for that to happen. I think there've been interesting cases of using private sector as more of bridge financing, where you can front load capital from private investors, provided you can come to terms on or come to an agreement on reasonable interest rates and terms, etc. Or that's a role that donors play in covering that, so countries don't bear it. But effectively, it's saying you could get, let's say, 100 million from private sector tomorrow, in order to conduct your programs over the next 5 years. And those 5 years buy you time to slowly start ramping up your budget space. Or it also can help donors manage their budgets, as we saw, especially in the aftermath of COVID, where donors had so many things coming at them all at the same time as priorities. And that meant that there was sometimes a danger of essential services getting neglected. So that's a case where big donors and bilateral donors in particular will say, we know we can cover this, we just can't cover it this year or the next year because we're fully committed. That doesn't mean that countries in Asia and Africa are just not going to deliver services in the meantime, right? So I think the front loading and bridging aspect could be a better use when we're thinking of the financing gap rather than filling it completely on its own. So I think those are some of the value for everyone questions to grapple with, and linked to that, along with value, how do you allocate the associated risks? Who is best placed to take on which risk in the partnership?
Yeah, that's an interesting question to leave us with, unfortunately, but maybe you could touch on that in your closing remarks if you want. But I do think there is maybe, that question of private sector financing, we haven't touched on quite as much as we've touched on more private sector goods production. I don't want to say it's service delivery, because that is still largely in the public sector, but using the private sector to transform the system that we're functioning in seems to be where our conversation has ended up concentrating. But there are a lot of other uses or tools with the private sector as well. So we are coming to time. I'm going to give our speakers the opportunity to have their closing remarks. While they're doing that, our participants can put their questions in the chat, and they can also raise their hand. I see we have one participant who has a hand raised. So once our speakers have done their closing remarks, Gabby can let people come on camera and off mute to ask their questions. But before we get to that, I'm going to hand it to Jenny for closing remarks.
Thank you. This is my favourite subject. Really could talk about this all day, and we really can't change the food system and deliver nutrition at scale without seed grain and food businesses. It's just essential. And the point about having seed grain and food businesses at project design is so important. Not only would they be part of the projects that we're trying to implement, but we're getting their supply chain knowledge and project design knowledge into projects at the outset, and they'll be part of it. There's a lot of very, very talented people in the food industry, and their objective is scale. And you look at someone, like a big noodle manufacturer in India has the potential for 2.5 billion servings a year. That would give us the program reach numbers for India. So it's bringing them along with us. And I really like the sentiment about taking a ride on other people's objectives, because very often the food industry is there with the same objectives. And again, my sentiment about changing the tone of the debate, making it more positive and less of the finger wagging and more of the, let's work together, because that attitude just switches people off straight away. They're all human beings in the food industry. If you're saying, that you're the cause of all of this, then you're just going to turn them off, and they're not going to play. You're just going to get people's backs up. It's just human nature. So being collaborative, open-minded, friendly, and getting everyone to the table so important, because we really can't change the food system without the food industry.
Yeah, I think that's a great point of both recognizing each other's humanity and human nature. We can leverage that as possible, and then also we can't change the food system without the food industry. Of course, I 100% agree. So Sneha, over to you for closing remarks.
I think just maybe a couple of things that have kind of stuck with me through the conversation we've been having today. One of them is the aspect of, I think, what colleagues have referred to as the finger wagging, especially for someone that works across sectors and not exclusively in nutrition. That is definitely something that has, I think, stood out to me when having a discussion, particularly around private sector investments and what does it make sense to support. And I think I would echo this kind of goal of being more positive in how we set up these interactions, but then also maybe forcing ourselves from a donor development community perspective, maybe even from an advocacy perspective, to think about where we need to be realistic and not to let the perfect be the enemy of the good. Because we've had, Jenny was mentioning noodles, we've had investments or potential investments come to us sometimes around, well, what about biscuits, and can we fortify biscuits? Now, are biscuits high up on the list of nutritious foods that we want women and children to have access to? No, but we know they're buying them anyway. So it becomes that question of, well, how do we then grapple with that? What is our role? And it may be different for different types of development partners, but I think there has to be a certain honesty that we have to bring to the conversation of what people are choosing to do, and that they can exercise those choices. So we have to kind of work within that framework if we want to create an impact. I'd say I think that's one big piece that I would love to continue the conversation with the community on. And then I think, secondly, there's probably still some more work to be done around, at least for us at GFF, identifying the best partners for the highest value partnerships. Because something that we grapple with, which may be the case for others, is, you have a fairly small secretariat. You, of course, have limited envelope of funds. And so you have to prioritize what you're actually going to set up. And for that, you probably want to think about what are the 1, 2, 3 things where you can get the biggest impact in partnering with the private sector. And maybe on our side, like taking a much more concerted look at that through the paradigm of our strategy refresh that we're undertaking now is, I think, one of the takeaways for me from this discussion. So thank you.
Okay, thank you both for all of these comments. I think it has been motivating and optimistic for me. I obviously do come pretty strongly from the nutrition sector, and there is a lot of skepticism there. So I appreciated this opportunity to hear about the great paths forward that are available for us if we choose to dedicate ourselves to them. And I think that that is going to be the next step for us coming out of the sector is, do we choose to dedicate ourselves to them, and how do we do that? So we have had one person with their hand up for a while. Gabby, I don't know if you are able to let that person come on camera and off mute, but I do feel bad that we've been ignoring our participant for the last several minutes.
You should have the ability to turn on your camera and microphone now.
I don't see the full name, McPherson.
Turned it on.
Yes.
Okay, well, good. Peter McPherson. I'm the chair of the board of this new structure related to Harvest Plus Solutions. And my comment question, I suppose, is that I think that working with the private sector, as well described by Jenny and others here, looking at their self-interest and motivation is certainly a key component. And in that context, it seems to me building demand in a broader community is an important part of this. I draw upon, I was administrator of USAID during a good share of the 80s, different time, different set of issues, well, at least somewhat different. And I look what we did with oral rehydration therapy, which was a way to deal with diarrhea and a huge killer of children. We in UNICEF, AID and UNICEF, conducted massive efforts that really facilitated the social marketing that we did. And I think the same kind of thing can be done here. I look at also, again, these are probably different days, but I look at what we did in Mexico, for example, with the soap operas on family planning. It was enormously effective. So how do the private sector will respond if they are much more likely to respond if there is a demand, if they can advertise their product as having certain additional value. And so how today there's social media in ways that we didn't have back then. There's lots of ways to look at this. But I think that those things, I know that Harvest Plus is looking at them, and I think more broadly it's important to do. I wish our really excellent World Bank representative, I wanted to ask her, where does biofortification fit into the plan? But she's gone, so I'll have to ask her another time. Thank you. An excellent panel. Thank you all.
Awesome. Thanks for that comment and question. Jenny, I don't know if you want to chime in there, and also Sneha, you may know a little bit more about where biofortification is fitting into some of this agenda, but I'm not sure if you are in the loop on any of those discussions. So I guess, Jenny, I'll first go to you.
Yeah, the consumer demand piece is definitely a huge driver. And this is when talking to the private sector, if you're talking to marketing people or nutrition people, it's then how do you promote zinc wheat or orange flesh sweet potato to consumers? What are the nutrition health claims and those kind of things you need to promote things to consumers? But it's not always possible because of regulatory frameworks and nutrition health claims regulations and the amount of nutrients in there. So consumer demand is part of it, but that business demand is a much bigger route to scale as well. And looking at the purchasing power of the food businesses, seeing the demand there is massive. And you can have consumer demand on very specific products and show great examples of where biofortified commodities are actually changing businesses. So it's having that consumer demand, but it's not the only it's not the only key to scale. That business demand is very much bigger and more powerful.
Yeah, I guess I hadn't fully thought through, if we would be able to slap some labels on biofortified food or how complicated that probably ends up being. I'm sure it's harder than I would wish it was, as well as you. Sneha, do you want to chime in at all?
Unfortunately, from the GFF side, Charlotte, I have fairly limited visibility onto the conversation around the biofortification aspect. So maybe something to follow up with Mira on afterwards.
I'm having trouble hearing Sneha. Are others as well?
No,
it's just me. Okay.
Okay.
Sorry. Keep going. I'll try this.
I was just saying that I think it would be better to follow up with Mira on the biofortification because it's not necessarily something that we've done, I think, as a priority from the GFF side.
I thought that might be the case, but I figured it was worth asking. We have one more participant with their hand up. So Gabby, if you can let them come on and ask their question, that would be great.
El Gioma, you should have the ability to do so.
Oh, I heard you for a moment and then you went back on. There you go.
El Gioma, you're on mute.
Okay, we got
Hello. Can you hear me? Good evening, everybody.
Good evening. Nice to hear you. Do you have a question?
Yes, I have a question for Jenny. I actually dropped it on the chat, but I think it was not attended to. Okay, I work with an organization that focuses on climate smart agriculture to help combat malnutrition. At the moment, we are implementing a project that has to do with healthy diet for Africa. So I want to ask, how can we partner with Harvest Plus? Because we're thinking of including biofortification into what we do. But I know it goes a long way in combating malnutrition because a lot of people take staple crops that are not fortified. So I was wondering, how can we partner with Harvest Plus and GFF? How can GFF help us to achieve this goal of combating malnutrition? Thank you.
Jenny, do you want to jump in there?
Thank you. Thanks for your interest, and yeah, please do. Let's talk after the event today. And I think the intersection between our climate priorities and nutrition have to be taken in together. And again, they are very, very common goals because a lot of climate principles impact on the actual nutrition of the food that we produce. So putting that climate and nutrition together is essential as well. So yeah, look forward to getting in touch.
And obviously, climate change is affecting crop yields and causing droughts and whatnot, which is causing a huge nutrition challenge. Sneha, she asked you a question as well. I also have a question for you. which is about specifically when you are working with governments and trying to facilitate, governmental private sector collaboration where GFF is a third-party negotiator potentially. So I was wondering how governments that you're working with are viewing the private sector. Is it like a great opportunity or a threat potentially, or somewhere in between?
Probably all of the above, based on the country and who you're speaking with and about what particular service or product. I will say there's been, I think, a little bit of a shift post-COVID, and I'm curious whether others are seeing that as well, because during the pandemic, I think the unprecedented demand led to much more, in some cases, forced collaboration between the public and private sector in a way that you didn't have before. I think the parallel systems ran on these kind of like tracks that they didn't really intersect for the most part. And many ministries of health didn't feel like they were actually, it was their job to also govern the private sector along with the public. It was like, well, they do what they want and like we take care of the public sector. However, I think in the last couple of years, we've seen a shift to actually governments trying to be more strategic and saying, well, we now know the role that they can play kind of across the spectrum of R&D, manufacturing, distribution, service delivery. So can we be actually a little bit more proactive to think about in the next 2, 3, 4 years, as we're doing our strategic plans, like where does it make sense to bring in the private sector? And some governments are much more open than others. And so on the GFF side, it's also been a conversation for us to say who are the right partners for us on the public sector side, because it may be a smaller number of countries, but ones who are really focused on this more medium-term reform of both public and private. I think in the last couple of months, I've had 2 senior Ministry of Health officials tell me that they don't like saying, we're public and you're private, like we're separate, and that we're actually part of one system and one network, which I'm pretty certain they did not say to me, not the same people, but that was not a common sentiment that was expressed several years ago. It was like, you want us to do what with the private sector? So I think there is a momentum building. And the question is, how do we put the right capacity and expertise in place to help governments become comfortable with it? Because a lot of it is still fear-based. We know it's difficult setting terms and setting contracts with private sector. They often come armed with better lawyers and they're more savvy. So that's also a place where I think the GFF, the World Bank, and others can play a role in equipping governments to say, we're by your side. We're going to help you figure this out. And we have the same goals of equity and access in mind. And we'll be there with you to help you, get through all the steps, essentially. And then just on Ijioma's question, I was going to suggest, I don't know if we have time, otherwise maybe offline, my colleague Biram might be a better person to speak with about that, the climate sensitive agriculture and nutrition aspect. So that's something we could do offline as well, if that works.
Yeah, I think we're about at time to wrap up. So I'm gonna suggest that you guys follow up offline. But I want to thank everyone for being on this conversation today. It's been, like I said before, incredibly interesting for me to hear. I love these very different projects that are experiencing the same basic challenges and dynamics and relationships. So we are not in this alone, which is always nice to hear and nice to get that sense of community, which is what we are here for. So what's going to happen after this is, we'll be sending out a summary. We also have a great panel tomorrow that's going to be pulling together what's been going on at the scaling community for the last, I think it's 3 weeks now. We've had those various panels. So this is the last one before the wrap up. And Johannes, I don't know if you are still on the call to give us any final words.
Yeah. Well, thank you very, very much, Charlotte. Thank you, Jenny, and thank you, Sneha, for terrific session. Mira, of course, also, but I will have to thank her separately. It's been really fascinating. I'm not a nutrition expert by any means, but I've dealt with nutrition one way or another, personally as well as professionally, I guess we all do in one way or another. So let me maybe summarize briefly a few takeaways I have. First of all, one of the panelists said private sector is essential for scale. I mean, yeah, I guess it's true for many other areas, but it's probably especially true for the nutrition area. And so we have to work on this alignment of interests. We have to work on a positive form of engagement, because if we come to the table with negative, you're to blame or you're bad, or whatever, then this is not going to take us very far. So if that partnership is essential, we better figure out how to turn it into a positive sum game rather than a zero sum or, God forbid, negative sum game. We of course have to get people into the same room. And I was very happy to hear that Mira said that's what the bank is now doing. Well, it's about time, folks. And okay, I was at the bank for 30 years of my professional life, and I should have done it way back. But okay, great. And I'm glad to see that the new president seems to be really going after partnerships and sending the message, because the previous president of the World Bank didn't. It was, if anything, just the opposite, which is maybe can be explained by some of the potential obstacles one faces. So one thing we heard, there are lots of different partners in the private sector that one has to be engaging with. So how do you actually get into the room? And there are transactions costs to this. So if you go into this partnership, private sector business, thinking it's a free lunch, well, forget it. It's not a free lunch. You have to pay for that. It takes time, it takes effort. And if you don't budget your staff time for that, the staff won't do it, or at least they won't do it at the level that is necessary. They have lots of other things that you ask them to do. So you got to budget it. You got to put the time and resources into doing. Then there are questions which we didn't talk about, which has always been a problem for me. We're going way back when we talked about industrial policy or whatever policy involving the private sector. We always knew we couldn't pick winners. We had to go for the level playing field, for the right policies, because if once you get into picking individual private firms to do business with, you are in serious trouble. And so you have to figure out a way, and it isn't easy. You have to figure out a way with working with private sector that is fair and even-handed, and basically creates a level playing field. So whoever is doing it best in the private sector to work with you, achieve the goals that you've set, is going ahead and getting whatever benefit they're going to get out of it. So those are some of the points I took away. In addition, by the way, to the demand pull, and there's one angle, the consumer demand versus the business demand, that one of the panelists brought in, which I hadn't thought about, but it's something worth perhaps exploring more. A final point, Charlotte, for us too, as co-chairs at this point of the community practice, we really have to follow this up with another webinar where we bring in private sector voices, because so far we've heard, the sort of research, pushing think tank or whatever you are from, Jenny, but the public, international public finance sector, we really have to bring in both the recipient country and government perspective, and very importantly, the private sector. But it's a terrific topic, so let's continue with this. And I'm very excited to know that the Nutrition Working Group is active, and I thank you all for having made this possible, and wish you a wonderful week, I guess this being Monday. And so all the best to everybody. Cheers.